USMLE style question on Hirschsprung disease, loss of function mutation in Rett, failure of neural crest migration, lack of ganglion cells in the distal colon. Question 1. A full-term newborn male fails to pass meconium within the first 48 hours after birth. He develops progressive abdominal distension and bilious vomiting. A digital rectal exam results in the sudden passage of a large amount of stool. Contrast enema reveals a narrowed rectosigmoid region with proximal colonic dilation. Which of the following best describes the underlying pathophysiology of this condition? A. Failure of obliteration of the omphallomesenteric duct. B. Failure of neural crest cell migration. C. Defective relaxation of the lower esophageal sphincter. D. Incomplete rotation of the midgut. E. Defective ganglion cell proliferation. Failure of neural crest cell migration. Explanation: Hirschsprung disease results from the failure of neural crest cells to migrate into the distal colon during embryonic development. This leads to a ganglionosis of the Meissner, submucosal, and Auerbach myenteric plexuses, which are essential for peristalsis. The Rett gene mutation, loss of function, is commonly associated with Hirschsprung disease. Since ganglion cells regulate peristalsis, their absence results in a functional obstruction, leading to delayed passage of meconium 48 hours, abdominal distension, bilious vomiting, explosive stool after digital rectal exam, transition zone on contrast enema, narrow distal segment with a dilated proximal colon. Other choices: failure of obliteration of the omphallomesenteric duct, Meckel diverticulum, defective relaxation of the lower esophageal sphincter, achalasia, incomplete rotation of the midgut volvulus. Defective ganglion cell proliferation is incorrect because the problem is migration failure, not proliferation. Question 2. A 3-day-old male newborn presents with abdominal distension and has not passed meconium. Physical exam reveals a tight anal sphincter and an empty rectum. A contrast enema shows a transition zone in the sigmoid colon, and a rectal biopsy confirms the absence of ganglion cells. Which of the following additional conditions is most likely associated with this disease? A. Duodenal atresia. B. Patent ductus arteriosus. C. Meckel diverticulum. D. Medullary thyroid carcinoma. E. Necrotizing enterocolitis. Medullary thyroid carcinoma. Explanation: Hirschsprung disease is associated with Rett proto-oncogene mutations, which also increase the risk of medullary thyroid carcinoma, MTC. This is particularly relevant in patients with multiple endocrine neoplasia type 2, MEN2A and MEN2B. MEN2A, medullary thyroid carcinoma, pheochromocytoma, parathyroid hyperplasia. MEN2B, medullary thyroid carcinoma, pheochromocytoma, mucosal neuromas, marfanoid habitus. Other choices: duodenal atresia, associated with Down syndrome, not Rett mutation. Patent ductus arteriosus, common in premature infants or congenital rubella. Meckel diverticulum, caused by persistent vitelline duct, unrelated to Hirschsprung disease. Necrotizing enterocolitis, seen in premature formula-fed infants, unrelated to ganglion cell absence. Would you like additional questions